Yeah, hi everybody. I'm Dan Madden from Sarepta. I'm head of patient services, and I'm going to talk about our SareptAssist patient service program today. First off, I'd like to thank PPMD for the opportunity to talk about the program. So the SareptAssist program, it's a patient support program, and it's designed to work with all the families to pursue treatment on one of the Sarepta therapies. The heart of the program is we have a dedicated team of case managers, and they'll work with you and your physician, your MD office, to figure out insurance, really. That's what we mean by reimbursement support. So we'll do benefit investigation, prior authorizations, and appeals if there are denials. We also have financial assistance options that I'll talk about in more detail in a little bit. And then we work with two pharmacies around treatment logistics. You can choose to get infusions in a hospital setting or infusion center, but most patients are on home therapy, and that's where the pharmacies come into play. And again, I'll talk about that in more detail. And I just want to mention a couple other members of the team besides the case managers. We have educational support managers. These are field nurses, so they're able to provide education. The case managers can put you in touch with, we call them SMs, and they can talk about the infusion. And if you have questions about our therapies, or especially about infusions, they're a great resource. And then we also have patient access managers who can work with you if insurance does deny access to the drugs. The patient access managers can help you with appeal letters and that sort of thing as you try to pursue getting those appeals in place. So the phone number is right there on the bottom, 188-SAREPTA. And when you call, you'll get a phone tree where you can just go and talk to any case manager, or once you are in the program, you'll have an assigned case manager. And then that case manager will work with you throughout your time working with the Sarepta products. Okay, I talked about the case managers a little bit. So we're located in Cambridge, Mass, which is where a lot of the rare disease drug companies are. And therefore, we've been able to build a really great team of case managers with a lot of experience. And insurance experience is really essential to seeking these therapies. And the case managers are well experienced in working with families, especially pediatric populations. We also have 3 case managers who are Spanish-speaking case managers, which has worked out really well. And we also have translation services for non-English families, non-English speaking families. And again, we're there Monday through Friday. We're all working from home now, like a lot of people, and it's worked out pretty well for us. The job can be done from home, and the team is still working hard to support the DMD community. As far as enrolling in SareptAssist, this is something your doctor would need to do, and we have a form called a START form. That's a referral form. And when your physician or somebody from the MD office sends that in, a SareptAssist case manager is going to reach out to you. There's a couple things that are real important up front. One is that genetic testing is available that shows amenability to either exon 51 skipping or exon 53 skipping. That's something that we really need to get started, and also insurance companies require. So that's one of the first things we make sure is part of the packet that we get. If not, we'd follow up with the MD offices to take care of that. Other thing that's really important is this consent. So the START form is a 2-page form. The doctor or somebody in the MD office would fill out the first page, which includes demographics, address, insurance information, and the physician signs off on that form. But it's also critical that we get either the patient's signature or the family signature or a caregiver signature, because we need consent to work with your personal health information. And the consent tries to spell out all the ways that we would use the patient's information. And one of the most critical things is if we're to pursue home therapy, we refer to one of our 2 pharmacies. So if most of the start forms come in without this signed, which is fine, and the case manager will reach out to the family and either get an electronic signature, or we can FedEx the form and get just a actual signature, if that's easiest. Whatever's easiest for the family is what we'll do. I'm not going to go through this in great detail, but this is what we call our service model. So there's a very well-defined process we go through to try to get approval and get patients started on the Sarepta therapies. The first box there I already talked about is getting that start form in. And that's something we work with the MD offices on, and also the genetic testing results again. Once we receive the referral, that's when we would reach out for consent, what I just talked about a minute ago. And then one of the more important things we do as part of our process is a patient welcome call. So that's where the case manager who's going to support you will reach out and call, and they'll explain everything about our programs and the process to gain access to therapy. We'll talk about our financial assistance programs. We'll give you a feel for, based on your insurance, how long we think it may take. And really the thing we want to make clear with that welcome call is that you can call us for anything. We'll reach out. We try to be very respectful of your time and not reach out and bother you too much, but you can always call us. Also, a lot of families email with us, even text. So all that we can talk about on a welcome call and share the contact information. And like I said, the case manager will work with you. Most of the case managers on our team have been here from our first launch, which is almost 4 years ago. So the idea is that you'd have that same case manager to work with you for a long period of time, which takes a lot of the confusion out. And then we figure out, are you going to be home therapy or are you going to be infused in a clinic? And maybe you're going to start in a clinic and then go to home therapy. So that's all important to figure out and is a big part of getting the insurance approval. And then we go through benefit coordination, which is figuring out your insurance and what a prior authorization might be. And you might get denials. I would say don't be too disappointed or worried if you get a denial, because we have a team that'll work on it. And it's not unusual the first time you submit a PA to get a denial, but there's a team in place to help you through all that. If there are denials, then we'll go into appeals, and in some cases, external reviews would be a way that you could possibly get an approval. And that's all real insurance details that the case manager can explain as you go through the process. Once you do get approved, then we have a lot of effort put into place to get that first infusion done and have it be a good start for the patient and for the family. So the case manager will confirm times, and we'll make sure the pharmacy is shipping drug and supplies and PPE, which I'm going to talk about in a little while. And then also our SMs, who I mentioned earlier, the educational support managers, the nurses, they'll train the infusion nurse who's going to do the infusion. And then there's ongoing support that our SMs provide those nurses. And then finally, that last couple boxes is just that we want to have a long-term relationship. There's so many things that can go wrong with insurance that you want to always stay on top of it. And also there may be, situations where a nurse maybe is going to travel or take some time off, and then we have to get a backup nurse, or you may be going on vacation and you'd like to inquire whether we can set up infusions while you're away on vacation. So we'll stay in touch at least once a month. Again, we want to be respectful of your time, but we want to make sure that we're providing a high level of support every step of the way. All right, I mentioned the financial assistance programs. Really, they kind of fall under these 3 main categories. First is that we have a copay program that if you have commercial insurance, meaning like a Cigna, Aetna, United Healthcare, then as a drug manufacturer, we can provide direct support to you. So we can help out with deductibles, copays, any out-of-pocket costs. You'll see sometimes insurance will have a 20% coinsurance with a a $3,500 cap, something like that. Those are the things that we can help with through this program. The case manager will sign you up, and we share that information with the pharmacy. And there's really nothing that you have to do to sign up for that program. And then we have a free drug program. They're often called PAP programs, patient assistance programs. And if insurance does deny and you exhaust all appeals, there's a process to get free drug for eligible patients. So again, the details of that are somewhat flexible based on your insurance situation. So that's something the case manager can talk to you about. And then the patient assistance foundations, there's a group called the Assistance Fund. TAF is the abbreviation. And if you were to Google TAF, DMD, or the case manager can give you the website, that's a DMD fund that's out there to support DMD patients with their therapies. And there's copay support, there's support for nursing, even some travel support. So that's another vehicle where you can get assistance. And then I just want to give you some updates based on some of the things that have been happening recently around COVID in particular. So our specialty pharmacy partners, and for you families who are on therapy, you'll know either Orsini or Option Care. When we were ready to launch our first drug, Orsini and Option Care are two pharmacies that are designated as specialty infusion pharmacies. So they work with a lot of drugs that have home infusion. So that's why we chose both of these pharmacies, and they've been great partners and are really patient focused and again, want to provide the best support possible. So if you are a family that's going to go to home infusion, you'll end up working with one of these two. And we'll explain that to you. The case manager will let you know, hey, Orsini is going to be the pharmacy for you. You're going to hear from somebody from the pharmacy. So those are really the two primary people you're going to hear from, the pharmacy and then also from the case manager. And we have a very close relationship with the pharmacies. We talk to them every day. So we review cases so that we're, again, trying to work together to, get through the insurance steps as fast as possible and start families on therapy. As we've gotten into this COVID situation or pandemic, both pharmacies follow CDC guidelines, and the nurses are very diligent in being prepared to go into a home to do infusions, things like washing their hands, wearing masks, all that is both pharmacies are on top of that, and they provide supplies to the nurses. I'm going to kind of jump to the last bullet. We recently, about a month ago, started our own PPE program. And the idea behind our PPE program is to send supplies direct to families. So we were able to, it was for a while, they're very difficult to get PPE supplies, things like gowns and masks, but we've now got a supply. So the case managers are reaching out to all the families, and we're sending things like hand sanitizer, digital thermometers, gloves, masks. We were able to get some N95 masks. We have adult masks. We're waiting for children's masks right now, but we have a pretty good supply. So if you haven't heard from your case manager and you're interested, you just need to give them a call and we can ship, and you'll have the supplies within a couple days. So far, I think families have been happy with the supplies they've received. And we're really not trying to replace what the pharmacies do. We just want to give you a peace of mind, give you some backup supplies to make things as safe as possible for your home infusions. And then I'm going to go back up to the middle bullet there, payer updates. So during this period of time, those of you who have been on therapy for a while know that when your prior authorizations are due to expire, most insurance companies want to have recent clinical notes from within the last 6 months. Well, lately that's been much harder to do, and appointments have been canceled. There has been a fair amount of telehealth, which has worked out well. But we work directly with the payers, and the payers, the insurance companies have really been very reasonable through this crisis, and we've been able to get extensions. So if your appointment were to be canceled, and your authorization was going to expire before you got in for your next visit, we'll request extensions to your prior authorizations, and that's worked out very well. And we have some letters that we use as part of our normal process, and one of those is a COVID extension letter that's worked very well. Trying to think, sorry, thinking on my feet here, but I think that pretty much covers that topic. I'd say if you have any questions at all, always please reach out to your case managers, and they'll be quick to respond, and we'll try to resolve any issues or answer any questions you have. So I just want to say thanks to PPMD again. Hope the meeting goes really well. I know it's disappointing not to all be together, but I think it could still be a great meeting, and I'm happy to have been able to participate in a small way. So thank you very much. Bye.